Have you ever wondered what cleaning at the dentist looks like? Let me show you. Welcome back. I'm your girl, the Niger Dentist. And if you're new here, welcome to this page. This page is about oral health education and oral health tips. Alright, stick around, tap on the bell notification, tap on the subscribe button as well, and I will see you in this video. Before I go on, I would like to explain why it is important to have your scaling and polishing, which is the cleaning done at the dentist. This cleaning helps to remove the tartar and plaque around the teeth. Tartar is hardened plaque. How is it formed? It's formed over time. When there's plaque and then it's not removed, like everything is not removed, it forms a hardened structure, which is the tartar around the teeth over time. So it's important that you visit your dentist to help get rid of this, to prevent gingivitis, periodontitis, which are like gum diseases that can eventually affect the teeth and cause you to lose your teeth. So it's important to do this cleaning regularly. Did I also mention that doing scaling and polishing could also help increase the shade of your teeth by at least a shade? It's not teeth whitening, but it will help increase the shade of your teeth a little bit. So let me show you how this is done.
Note, I have reduced the speed of this video to give you a good look of what the procedure looks like. The dentist or the dental hygienist examines the mouth properly and begins the scaling and polishing. The scaling is done using an ultrasonic scaler. An ultrasonic scaler produces vibration, and in this case, it brings out water from the tip. The water is pressurized. All this aids in the removal of the calculus around the teeth. Note that you can see blood, but the procedure is absolutely painless and would not inflict any pain whatsoever on you. The only reason you're seeing blood in this case is because the calculus is close to the gum and has been irritating the gum. So I'm sure in this case, the gum is actually like, oh, thank goodness, this bloody calculus is gone. So the dentist removes all the dirt around the teeth using this ultrasonic scaler. Following the ultrasonic scaler, which is an electronic device, the dentist or dental hygienist performing the procedure then uses a manual scaler or a curette to further remove the dirt around the teeth and give the teeth a well-finished and rounded look. Then the polishing is done. And the reason for doing the polishing is to smoothen the surface of the teeth. You then examine the teeth to be sure that the procedure has been well done. This video is only showing for the front part, but all sections of the teeth are usually done. I'm sure this teeth is overexcited right there, like, wow, I'm so grateful to this dentist.
Who should do your scaling and polishing? Ideally, in a dental setting, the dental hygienists are the ones who do the scaling and polishing, and sometimes the dentist might also do it. And anytime the dental hygienist does your scaling and polishing, the dentist will still come and oversee and say what has been done to see if there can be any improvement, which is good. How often should you do scaling and polishing? Ideally, you should visit your dentist twice every year. That's every 6 months. So once the checkups are done, the dentist will decide whether you should have a scaling and polishing done. So every 6 months, the dentist should check your teeth and tell you, oh, you need to have this done, or no, you don't need it for maybe another year. So it's not something that is done very often. So that's why I think it should be on everybody's schedule. You should register at your dentist, and if you are not registered at any dental clinic, make sure you schedule an appointment with your dentist. It won't take long. I can't overemphasize how important the oral health is. Once we grow our adult teeth, that's what we have through our life. So it is important to take extremely good care of it so that it can last the duration that God has intended for it to last for us. So take care of your teeth, visit your dentist, schedule an appointment if you haven't, and thank you for watching this video. I really appreciate it. Make sure you give this video a thumbs up, share with your friends, share with your family, and make sure you put a smile on somebody's face till I see you in my next video. Ciao!